Imagine, just for a second, you're walking through a crowded medieval city. The streets? Incredibly narrow. Raw waste is literally running freely in the gutters right next to your feet. There's this heavy, sweet, terrifying smell of rot hanging thickly in the air, and just nearby, marsh water is sitting stagnant under the baking sun. Suddenly, your neighbors start falling sick. Fever, coughing, deadly diarrhea. With no microscopes, no germ theory, how do you explain it? Well, to our ancestors, the answer was as invisible as it was terrifying. What if the air itself was trying to kill you? Welcome to The Explainer. Today, we're taking a fascinating look at an incredibly powerful idea that absolutely ruled the world for centuries.
Okay, let's dive into this. You see, for much of human history, the idea that the air around us was weaponized. It wasn't science fiction. It was the accepted, unquestioned medical reality. Humanity looked at the foul vapors rising from swamps, open sewage, and rotting matter, and they concluded that these smells were the direct, immediate cause of deadly diseases. If you smelled something bad, you weren't just offended, right? You were quite literally breathing in a death sentence.
And that brings us to the core concept of our explainer, miasma theory. Put simply, miasma was believed to be this poisonous air, absolutely full of foul vapors that entered the body through breathing and corrupted your health from the inside out. Now, obviously this theory is completely discredited today. We know smells don't cause infections, but here's why this matters, and it's a huge but. Even though it was entirely 100% wrong about the true cause of disease, this singular idea was so powerful that it successfully guided global medicine, architecture, and urban planning for generations. Entire societies literally built their whole world around avoiding bad air.
So, to really understand how this theory got such a tight grip on humanity, we have to look back. Section 1, Ancient Roots of Miasma.
It all started way back in the 5th century BCE with Hippocrates, the ancient Greek physician we often call the father of medicine. In his famous text, On Airs, Waters, and Places, Hippocrates shifted the blame for sickness away from angry gods and curses and placed it firmly on the environment. This was a massive step forward for human logic. Then, the 2nd century Roman physician Galen expanded on this. He taught that foul air threw the body's 4 humors out of balance. What we get here is a really brilliant mix of keen observation and totally flawed medical logic. They noticed that people living near swampy, foul-smelling places got sick more often. They saw the pattern, clear as day. They just blamed the air rather than the microscopic pathogens and insects that were actually living in the water.
And you gotta understand, this wasn't just some localized Greek or Roman quirk. This was a remarkably widespread belief that stretched across centuries and continents. Just look at the sheer scale of this. In the 1st century BCE, the Roman architect Vitruvius was designing entire cities specifically to avoid the morning mists from swamps. Jumping across the world, texts from China's Sui dynasty explicitly warned of dangerous southern vapors causing feverish illnesses. Fast forward all the way to the 17th century, and brilliant chemists like Robert Boyle were theorizing about invisible effluvia, these tiny, dangerous particles in the air affecting our health. So for thousands of years, brilliant minds across the globe were united by this invisible threat, completely unaware of what was actually happening. Eventually, this deeply ingrained belief in poisoned air was put to the ultimate horrifying test, which brings us to Section 2, Fighting the Black Death.
Now, what's really interesting about this slide is looking at the blamed on column to see just how desperate and elaborate the explanations became during a major crisis. When the devastating bubonic plague hit in 1348, the absolute smartest minds of the day, the medical faculty of the University of Paris, blamed it on air corrupted by earthquakes and strange planetary alignments. No kidding. Centuries later, during the 1793 yellow fever outbreak in Philadelphia, the highly respected physician Benjamin Rush blamed the devastation on foul vapors rising from a pile of rotting coffee beans on the docks. These were highly intelligent people constructing wild, elaborate environmental explanations because they simply couldn't see the fleas or the mosquitoes that were actually responsible.
And this desperate fight against bad air, well, it gave us one of the most terrifying and iconic symbols of historical medicine ever, the plague doctor's mask. We've all seen this creepy bird-like beak, right? But the incredible thing is, it wasn't actually designed to be scary. Physicians, like the Catalan doctors you came to Agamot, truly, genuinely believed that the plague originated in corrupted air. Therefore, that beak was essentially an early gas mask. They stuffed it with aromatic woods, herbs, and sweet spices. They thought, hey, if you can filter out the bad smell, you can filter out the disease. It's wild to think about.
But here's where our explainer takes a really fascinating turn. Welcome to Section 3, Good Habits, Bad Theory. We've officially arrived at the central irony of miasma.
Acting on this completely incorrect, deeply flawed scientific theory accidentally ended up saving countless lives. It's incredible to look at these massive historical actions as basically accidental building blocks of modern health. For instance, in 1388, the English Parliament banned dumping dung into rivers specifically to prevent corrupt air. In 1717, Italian physician Giovanni Maria Lancisi convinced people to drain massive wetlands because he believed the marsh vapors caused malaria. And in 1860, Florence Nightingale relentlessly mandated open windows and strict cleanliness in hospitals to battle what she called crowd diseases floating in stale air. Banning dung, draining swamps, ventilating hospitals, it worked perfectly. But not because it stopped bad air, it worked because it removed waterborne bacteria, destroyed mosquito breeding grounds, and cleared out airborne pathogens.
This wave of accidental brilliance just kept going right through the 19th century. Reformers like Thomas Southwood Smith vividly described cholera to the public as a deadly black cloud hanging over slums. And this absolute terror of the black cloud inspired Edwin Chadwick's landmark 1842 report on sanitary conditions, which actually led to Britain's Public Health Act. It's even the reason Baron Haussmann bulldozed narrow slums in Paris to build those wide, breezy boulevards we know today. By removing the filth just to get rid of the smell, they inadvertently championed the removal of the real, hidden pathogens.
This whole dynamic reached an absolute boiling point in the year 1858, an event known in London as the Great Stink. The River Thames became so overwhelmed with raw sewage that the smell was just unbearable. Politicians and citizens literally thought the stench was going to trigger a mass extinction event in the city. Can you imagine the panic? The terror over this miasma was so intense that they hired engineer Joseph Desalges to build a massive, complex, and incredibly expensive sewer system. And you know what? That sewer system saved London. The pure, unadulterated fear of a smell practically invented modern urban sanitation.
But as we know, science was advancing. That brings us to Section 4, the microscopic revolution. The thousands-year-old paradigm of the poisoned air was finally about to collapse.
The absolutely crucial turning point happened in Soho, London in 1854. While the famous statistician William Farr was busy drawing these meticulous maps, trying to prove that cholera lived in the foul air hovering near the river, a physician named John Snow was looking closer. Snow noticed that the victims all shared exactly one thing: they drank from the Broad Street water pump. He famously had the handle removed from the pump, the cholera outbreak immediately stopped, and Snow proved the killer was in the water, not the air. It was a massive, game-changing blow to miasma.
Let's move to and see how this builds into an unstoppable scientific revolution. After Snow's breakthrough in 1854, the dominoes really began to fall. In the 1860s, Louis Pasteur conducted his brilliant experiments proving that microscopic living organisms, not spontaneous decay or bad air, were causing physical changes. Then, the definitive nail in the coffin. In 1876, Robert Koch actually identified the specific Bacillus anthracis bacteria. He proved without a shadow of a doubt that a specific, physical, microscopic bug caused a specific disease. The invisible enemy finally had a face.
This crumbling of the miasma theory completely revolutionized human existence. Public health pivoted entirely. We finally stopped carrying sweet-smelling herbs, burning incense, and running away from smells. Instead, modern prevention was born. We shifted to the active destruction of pathogens through sterilization, the development of vaccines, and the rigorous treatment of clean drinking water. Cholera wasn't some spooky black cloud anymore. It was a treatable, preventable bacteria.
Looking back, the story of miasma theory isn't just a story about ancient people being foolish. Not at all. They were actually incredibly observant. They noticed that crowded slums, swamps, and filthy streets bred sickness. For centuries, humanity was absolutely right to fear an invisible enemy rising from the filth. They were looking in exactly the right direction. It just wasn't the air. It was microbes. And it leaves you wondering, what other hidden truths are we completely misunderstanding today simply because we don't yet have the right lens to see them?